So today I did a one-on-one with a veteran. It was a little emotional there. I almost cried. True story. But this veteran has an absolute solid evidence in service and current evidence for increases for migraines and mental health. And I'm hoping you can take away from this meeting to help your situation. Check it out. If you want a one-on-one, you know the deal. You have to share a long-form video, screenshot it, and email it to TheCivDiv@gmail.com with the subject line one-on-one, and we'll be rolling out more free one-on-ones as we go. All right, so I created this Word document. I'm going to give you access to it, okay? Before we start, I just want to double-check everything's correct. So starting with years of service, we have 2 active and 13 years in the Guard. Is that correct?
Yes.
And your deployments are Korea and Saudi, and you do rate the PACT Act.
Right.
All right, cool beans. Now, service connected, I have you at 87. I know you sent me an email that said 86, but there's a bilateral factor in there that I don't think you accounted for, but no big deal. You show at 90.
Okay.
So I have 30% for migraines, yeah?
Mm-hmm.
And 30% for mental health.
Right.
And then lumbar strain, sciatica, and each leg all at 20%.
Right.
And then your neck at 20.
Right.
Ankles at 10 and tinnitus at 10.
Right.
All that looks good? Am I missing anything?
Nope, all looks good.
Okay, and their denials are dry eye with whatever that is, and then TMJ, and we'll cross this bridge once we get there. Is there any other denials that we missed?
Nope, just those 2.
All right, and right now you have a current intent to file, which you just filed, and then for healthcare-wise, right now it's VA-provided chiropractor, mental health, and podiatry.
Correct. Podiatry, I haven't had that appointment just yet, but I am on the books.
Okay, that's fine. Podiatry is pending. Okay. Now with this, how the process is going to go, okay, it's going to go increase. We'll talk increases first, then we're going to talk secondaries, then we're going to talk denials, then we'll talk new conditions and presumptive conditions. Now, straight out the gate, because you are at 90, this plays a huge role into what I'm going to recommend you to do, right? Because going from 87 to 89 is still 90. Or
Right.
going from 87 to 91 is still 90. So there's a pretty large leap that we have to cross here. So what I'm going to do is, I should have had this up already. I'm going to put this into a calculator, and then that will allow me to play with the numbers once we have this all figured out. Cervicals 20, ankles 10, boom, 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 tinnitus 10. Yeah, so 87. You have a bilateral factor of 4.8, which is really good, and we'll cross that bridge later on. Okay, so starting with increases. First, we know migraines could be 50%. And so starting there, talk to me about your migraines. What does that look like on a month-by-month basis?
So I actually was writing some stuff down earlier because I haven't been keeping track of everything. I just try to spit it out from memory. And then once I really started paying attention, I'm getting, I would say, 2 to 3 migraine, maybe even 4. I feel like I'm pushing 4 because they recently prescribed me some medication for migraines, and I'm almost out, and it's not even the end of the month.
Is that the VA prescribed you that?
Yes.
Is that sumatriptan?
Doesn't sound familiar. Bear with me.
It's okay. I don't need to know the exact name. What dosage is it? Is it like 10 milligrams, 25? Is it 50, or is it 100?
I don't remember.
Okay, so the only reason why I'm asking is because it's kind of depending on the dosage and the medication. It's hard medical evidence to how severe your migraines are according to your primary care at the VA, which is going to come in clutch when it comes for evidence.
So it is sumatriptan, 50 milligrams.
50?
Mm-hmm.
Okay, solid. That is off the bat. You have solid evidence there. I'm a big fan of medication for migraines. So you said that you took the entire bottle of sumatriptan. Was that just prescribed to you recently?
It was so almost. I think I has like she gave me a quantity of 9, and I've used like 6 already.
Okay, and when was that prescribed? Roundabout. I don't need the exact date.
February.
Okay, February. So from February to March, was it the beginning of February or end of February?
Fill date February 26th, so exactly a month.
Okay, so according to your medication dose, that's 6 per month, right? So the reason that matters is because self-reporting is one thing, and I'm not saying it sucks, but saying you get 4 migraines per month is not as good as evidence when you compare it to where I've taken 6 sumatriptan at 50 milligrams the last 30 days. One is hard medical evidence, one's not. You have hard medical evidence, which is great. What I'm going to recommend you to do is I'm going to recommend, just based off of 6 migraines per month, which is on the higher end, definitely refill your prescriptions and continue doing your healthcare routine as you see fit. I would definitely refill the prescription now, and then plan to submit a migraine claim for that. Okay. Now the recommendations. So at the end of this, recommendations are going to be like your plan, and these are just options. So you can pick and choose which one you want to do, which one you don't want to do. It's totally the ball's in your court. Okay. I think this is a very good claim. At the end, I'll color code on what I think is, strong versus weak. I think your migraine increase is solid. I'm also going to I'm going to recommend you write a personal statement. Have you ever written one before?
Not like a formal one. I think I sent you like how I described my thing. I did that, like a synopsis, if you would say.
Okay, that's good. Yes, I did see that. I'm going to give you the link for this statement just so it's all in one spot. But what I want you to detail is medication taken per month. And so the example, right, would be something along the lines of from February 26th to March 26th, I had 6 severe migraines and took sumatriptan at 50 milligrams per incident, ending on March 26th. There we go. Like that would be an example, and that's pretty much what you told me, okay? And so craft your statement however you see fit. I added the example in there, but I really want you to talk about your medication taken per month, because that is hard medical evidence that can't be refuted, okay? Now, side note on migraines, for some reason, okay, it's due to the ambiguity of how uncertain migraines are. And so if that comes back continued at 30%, I would immediate higher level review. Higher level reviews for increases on migraines are the most common HLR when it comes to being awarded. So just keep that in your back pocket. But you have the evidence, and so I'm very confident that's going to be solid. Okay, that's migraines. Let's talk about, we'll save that for last because I assume that's going to be an increase there. Looking at your lumbar strain and your left and right sciatica, I'm not going to recommend you touch that at all, personally. Even if unless you have like very, very severe limited range of motion that would rate 40% for your back or your lower spine, I wouldn't recommend touching your back at all, personally. Now, with that said, I like to give you options. So can you talk to me about your range of motion on your back?
Yeah, so worst days, and I was actually satisfied with these ratings, honestly. With my back, I have severe sciatica. I can't sit or stand for very, very long. It is more on my right side than my left side. So again, which is why I was happy with the both. It is like bending forward. It's almost like you have to warm up, like, okay, let me warm my back up before I can actually bend down and tie your shoes or whatever. That is, we'll say in a week, I don't know, 5 days a week where I'm feeling that, especially sleeping. That keeps me up at night, mostly again on my right side. So,
okay. So it sounds like it could be an increase from 20%. I'm still not going to recommend it personally. Just keep that in your back pocket as an option. Okay. If you ever go for an increase on your lower back for range of motion, it's going to be for bending forward, bending backwards, laterally, like side to side, and then rotation of. When you do that, your radiculopathy, your sciatica nerves are going to be reevaluated as well. So, gosh, I would caution you there because this is a very solid DBQ completed for your lower spine. Okay, your neck, another solid rating at 20%. I would not recommend that either unless your arms have the same feeling that your legs do. That's the only way I would recommend touching the cervical strain. So with that said, talk to me about your arms. Do they go numb? Do they tingle? It would be very similar to the feeling in your legs.
Yeah, so that not so much numbness, but I definitely get the tingling, again, more so on my right side. I did get x-rays done recently through the VA. Real quick, well, the lumbar, I have mild DJD. So of course I watched a ton of your YouTubes and it's DDD. So I had to look up the J, and it's just the joint.
Yep.
Of the L5S1. And then the cervical part, there's a straightening of the spinal curvature in the lateral view. And then a rudimentary right cervical rib. And I Googled that. I haven't had a chance to talk to the doctor about it, but it's almost like I have an extra rib that kind of happened over time or something like that. But I'm waiting to get a little bit more feedback from that, because I was thinking, okay, well, is that secondary to something, or the cervical? Because that's what they found on the X-ray.
Not quite.
Okay.
Unless you can show that the cervical, unless your spine caused it, which it doesn't seem like that because that would have been annotated. I'm looking at your X-ray results right now too, that you sent me. So it doesn't seem like that. Personally, I wouldn't worry about that. And there's no mentions of your nerve damage stemming from your cervical spine into your arms either, and that would have been annotated as well. And so with what I'm looking at here, I'm not going to recommend anything for your back at all. Okay. I'm not saying you can't do it. It's just I wouldn't recommend it. Ankles are largely rated at 10%. It's 0 or 10% is what you'll commonly see ankles at. Those are solid ratings for ankles. I wouldn't recommend touching those either. I see the X-ray results for those as well. And there's nothing indicating that it would be a higher rating, right? Because it's going to be based on range of motion anyways, and ankles are basically 10%. And then tinnitus, we're not going to touch tinnitus for obvious reasons. Okay. So that's increases, except for mental health. Let's go back to that. Okay. So you said you watched YouTube. I'm just going to ask you straight up, and you don't have to explain it or describe it to me at all. But do you think you rate an increase for mental health, and why do you think you rate an increase for that?
Because now that the psychologist wanted me to really pay attention to my symptoms, because I do see the psychologist through the VA. And as I started writing them down and paying a little bit more attention, I'm noticing like I'm getting more panic attacks. I'm one of those that was like, oh my God, it's just mental. Like nothing's wrong with you. Just change your mindset. Like that's always been my thought process.
Yeah.
But now that I'm trying to be a little bit more open about it and transparent, I'm like, oh my God, okay, my heart is racing. Why is my heart racing? Why do I get agitated easy? I get agitated very easy now. That was not a thing before. Just like being around people, I've always felt like I was just a people person and want to be around everybody all the time. And I'm like, nope, I'm just going to stay home. So once I really started paying attention to those, or like excuses that I would make with friends, sadly, and be like, well, I don't want to go, I'm tired or whatever. But no, I just don't want to be around people. I don't like people like that, you know?
Yeah.
And I feel really bad. And I still feel bad to say that, but that's something that I'm trying to work through. So once I really started, again, watching the videos and paying attention after talking to the psychologist, I'm like, maybe I really do got something wrong with me that's over 30%.
Okay. Yeah. The service can, like, there's something wrong with you. And I'm saying that in the VA rating context. But what you described sounds like 50%. And I'm saying that based on the current rating criteria, with feeling not emotionally disconnected, which we'll get to that in a second, but just feeling disconnected from friends and family probably is in there. And then your panic attacks is the main reason why I think you're describing 50%. Okay. There's potential for 70%. Based on how you described it, I wouldn't be hopeful of 70%, but I'll describe what 70% looks like just to help you frame your mind, right? So do you have children at all?
I do. One.
Okay, so here's what 70% would look like for a mom. And this is one of a billion examples, okay? So someone at 70% might be emotionally disconnected, or they might have trouble sympathizing sorry, with your children, okay? That's probably, just based on how you reacted to that, I would just go ahead and do an increase. Personally, that's what I would do. I won't describe it more than that. I'm going to send you a video that does describe it, so I can keep my cool as well. I also have children. I have 4 of them.
Yeah.
So let me do that. Okay. But based off that, at a minimum, we're going to do an increase for sure. I'm not even going to sweat it. Let me get this before I forget. Okay. Now, to transition that into a good note, all right, I'll put that at the bottom here. Mental health, for sure. Increase. I'm also going to recommend a personal statement. This is going to be separate from your migraine one, okay? And really talk about symptoms described in this video as they pertain to you. That's the link. And that link basically goes into what I was about to say. Okay, so watch that. Take it in, however that pertains to you, and it will help you articulate what the heck is actually happening. Okay,
That's good.
So watch that for sure. But on a good note, and I want to show you this too. Make sure that comes up. Okay, so this is you right now. You're at 87%. With a bilateral factor of 4.8. This is your mental health rating right here, 30%. If that goes to 70 alone, that's 100%. Okay, which is possible for you. And let's just talk. It's not 70, it's 50. Then that puts you at 91. So you're in the 90s with the 50%, but you're 100% with the 70. So that's a long way of me saying really pay attention to those symptoms. And I would definitely seek healthcare about those specifically. And then really during your CMP exam, it's those symptoms that's going to drive that home. That is your easiest route to 100%, just to be straight up with you. Okay. Is this right here. And I say mental health, but when you click increase, it's going to be this. But that's what that looks like. As far as increases go, that's about it. Secondaries, I wouldn't recommend secondaries for migraines. The correlation there is pretty weak. You already have tinnitus. Do you have a diagnosis of vertigo at all?
No.
Okay. For mental health, there's a ton of secondaries for mental health. Let me pull up this list here, and I will show you some of them. And at a minimum, you're going to need a diagnosis, but secondaries to mental health aren't as easy as others. Pull this up. Okay, so this is a common secondary list. And looking at mental health, which is here, it's going to be sleep apnea, GERD, IBS, hypertension, migraines, you're good. FSAD for you, which is female sexual arousal disorder. You don't have to comment on that at all. If you have that diagnosis, I would just submit the claim and call it a day. Asthma, artery disease, chronic fatigue syndrome, diabetes, obesity. Obesity is not rated. It would be an intermediate step, and I would only recommend that depending on the route you're going. Same thing with alcohol use disorder, and then bruxism, which gets at your TMJ denial. So those are your common secondaries for mental health. My question to you is, have you been diagnosed with any of those?
So the bruxism is in my dental record, which is why I just went for the TMJ. Again, I kind of did that. I was doing it myself. Is that an actual rating though?
So generally speaking, it's going to be roped under your mental health generally. Can it be rated? Yes. But let's just talk about TMJ real quick. Based on what you said, I'm going to recommend you file a claim for bruxism. And the real answer is the VA is going to do what the VA is going to do, right? If they rope it under something, it's not our problem. Our problem is to submit claims. You're already going to submit an increase for mental health. There's no reason to not submit for bruxism. And I'm saying that because I already read your decision letter and your denial for TMJ. I'm going to read it just so we're all on the same page here. Your denial for TMJ, which is down here. Okay, I'm going to read this verbatim just so we're on the same page, okay? The evidence does not show a current diagnosed disability. That's one big hitter there. The second sentence is your service treatment records do not contain complaints, treatment, or diagnosis for this condition. Basically, that's the VA's way of saying you don't have TMJ, okay? Based on that decision letter. But if you have a bruxism diagnosis in service, it's weird that they wouldn't mention other dental conditions, even if it wasn't related to TMJ. That part I'm kind of worried about, but if you have a diagnosis of bruxism, don't sweat it. That's good enough for me. Bruxism, that would be a new condition, okay? And that's it. I would just leave it at that, especially if you have the diagnosis in service. And the VA is going to rope that under something, so be it, not our problem, okay? It's not secondary because you have the diagnosis in service, by the way. So your back, the number one secondary to your back is sciatic nerve damage, which you already have rated very high. Another common secondary is a bladder condition. If your spine is essentially pushing everything around, maybe it could cause a bladder condition like urinary frequency. So for that, my question to you is, what's your bladder like? Are you out here just using the restroom a lot? Like, what does that picture look like for you? Or is it normal?
So I like to almost deflect on that because I really don't know. I'm like, well, I had a child, so
yeah.
You know what I mean? So I don't know if it's actually normal or if it is because I had a child. I don't know how I would.
All right, that's fine. It's common. It's commonly connected, not commonly claimed. So we'll probably leave that as is. Cervical strain would be the nerve damage that we already talked about. And based on your x-ray results, nothing else really showed up from your neck or for your upper spine. So we'll leave that as is. Ankles, we will leave that as is. There's potential for a knee secondary. That's very difficult to do, but it's possible. And so just to hit all avenues, can you talk to me about your knees? Do your knees hurt? Do you have a diagnosis of a knee condition? What does that look like for you?
So my knees are fine now, but I was looking at shin splints. I'm not sure if that's a rateable condition, but I get more shin splints than anything with my knees.
Okay, it is. It absolutely is. It's based on treatment, though. That's the part that sucks. And there's a time criteria with that. I want to say it's 1 year. It might be 6 months of treatment. Basically meaning it's hard to get 10% for shin splints. I've actually never seen it personally. Not saying it's that you can't do it. I just wanted to let you know that up front. So with that, is there any complaints of shin splints or shin pain in service?
Yes, and that was with my ankles. I was kind of doing
Right.
a physical therapy in conjunction with my ankles.
While you were in service, correct?
Right.
Right. That right there is way more evidence than most veterans have. So we're going to submit that direct. Direct. Secondary would not be the way to go for that at all. Okay. That's secondaries for ankles. Well, that ended up being a new condition. Tinnitus, we already covered. Vertigo, I'm going to assume you don't have Meniere's or require hearing aids for hearing loss. Is that correct?
Right.
Okay, cool beans. Your TMJ, we covered that one, not diagnosed, no evidence in service, and that really is bruxism. I didn't read the decision letter for your eye condition. Let me look that up real quick. Eye, which is denied. Okay. So you have been diagnosed with, so you have the eye condition. It was denied Terra connection.
Yeah, I don't understand all that stuff.
Yeah, don't Terra is one of the hardest things to understand about VA disability, actually, so I wouldn't even sweat it. So basically the VA is saying you're denied direct and you're denied on a presumptive basis. So you're actually denied twice, which is a double cut. Okay. Did you complain about your eyes at all in service?
Maybe like once. I have to go back through all my medical records and check. I think a lot of us were because it was so dusty out there in Saudi, and being on the flight line, we weren't really blocked from it.
Yeah. So that what you just described is basically Terra. It's weird because the VA doesn't say they didn't find in-service events, which they would have. It just says there wasn't a nexus between your condition. I'm personally going to do I'm going to recommend a higher level review for that. Eye conditions are generally 0% anyways, so it's not a huge deal, okay? At all. That's your bilateral eye, dry eye with pre-glaucoma. Now, this would be a reason to do the HLR. Okay, whatever. Doesn't matter. HLR with an informal conference. Exactly what you just said to me about your eyes bothering you during service while you were in Saudi on the flight line is exactly what I would tell the higher level reviewer when you do an informal conference. Have you ever done an HLR before?
I have not.
Okay, so it's not intimidating whatsoever. It's stupid easy. Once you submit the HLR, at some point, could be months, the VA will call you on your phone, right? And it's a VA rater, and the conversation is candid, how I'm talking to you right now. It's very informal.
Okay.
It's just saying, hey, talk to me about your eyes. And that's what you would do. You would talk to them about your eyes. What I would recommend you do is drive that conversation specifically of your time in service. So no one cares about your eyes hurting pre-service. No one cares about your eyes hurting right now. I want to know about your eyes in Saudi. Exactly what you said to me, but more detail. Does that make sense?
Yes.
Because you need to build an argument for the Nexus, essentially, because that's what you were denied for. And I think that would at least warrant another exam and have another set of eyes on it. I'm not too favorable on it, to be honest with you, but we'll throw it on the list.
Okay.
So that covers denials. We also looked at increases, secondary denials. We already have new conditions. So from that, outside of bruxism and shin splints, is there anything you were seen for in service that you did not claim for whatever reason?
Yes. So, well, with the chiropractor, like my hips, he had mentioned a few things once I went back in because my hips are uneven. So he would always have to like adjust my hips somehow. He does his little thing. Or he would show me, and this part was also in my medical records again that I didn't thoroughly look at, but my feet would be off. So when he adjusts me, it was all in my lower back that he says, "Do you walk with a limp?" And I'm like, I don't think so, because my feet would really be like off of each other. Again, I don't think that I walk with one, but he was a really good doctor. And I noticed some things in my medical records that mentioned the hips. I don't remember the terminology that he used.
Okay, so I just want to clarify something. Your chiropractor is from the VA, right?
When I was in service, no.
Okay, perfect. That's all I needed to know. Yeah.
Okay.
So yeah, you saw a chiropractor while in service.
Right.
Perfect. All right. That makes me feel a lot better about all of that. So definitely bilateral hip. Is it pain? Do you have pain in your hips?
If I'm depending on where I'm moving it, like if I move it up and down, I'll get pain in both sides.
Yep. Okay. New condition. Your evidence seems very solid for that, actually. Now, I do want to tell you hips are largely rated at 0% too. Okay. You can get multiple ratings for each hip. Generally speaking, it'll look something like 0, 0, 10. Okay. At least that's what I've seen just by looking at a lot of hip conditions. So with that, don't sweat it if it comes back at 0. It's very, very normal because the hip range of motion is very large. Like it's difficult to be rated. But if you are rated for both hips, that would up your bilateral factor, which would make your 50% for mental health a pretty solid rating. Okay. So we're definitely going to claim it. Are there any other conditions, just like your hips, that you didn't claim for whatever reason?
No. All
right. I'm going to assume your hips currently hurt as well.
Yes.
Okay, because you're going to need a current diagnosis for that. I do think your chiropractor now is going to be enough evidence to lead an examiner to a diagnosis. But in the meantime, if you want to go get diagnosed for a hip condition, that would not hurt your cause at all. Okay. Is there a plan for you to do like an MRI at the VA by any chance?
No, we haven't talked about it.
I'm only asking because you had the x-rays for your whole spine. I was just wondering if they were going to go forward with MRI, but no big deal if not. But you have evidence from service, which is already a billion times better than most veterans to start. Okay, the last thing I want to talk about are presumptive conditions, specifically from PACT Act and Saudi. When were you in Saudi?
2021.
Okay, so the 5 most common are going to be sinusitis, rhinitis, and bronchitis. And then the other 2 are going to be asthma and IBS. Do you have any of those at all? Or do you think you have any of those at all?
Can you say them one more time?
Sinusitis, which is like your sinuses right here. You have polyps down below your cheekbones. If you push on this and it hurts, you got something, okay?
Okay.
Where you're like right below your cheekbones on the side of your nose. If it hurts, something's going on. That's sinusitis and rhinitis. Then you have bronchitis. You'll know if you have bronchitis. The other two are asthma, so like wheezing, right? It's not necessarily running out of breath when you go up the stairs, right? Although that would be a part of it. But like wheezing for air, asthma, the need for a inhaler, or IBS, which is just going number 2 a lot. IBS is much more than that, but that's basically what it is.
No, I don't think I have any of those right now.
Okay. Just because you're thinking about sinusitis, if you wake up in the morning and you are stuffy consistently, you probably have rhinitis, probably. And I'm just taking a wild guess based on just how you reacted to that. So if that's the case, just get a diagnosis. All you need for those is a diagnosis. So if you think you have any of them, I will just talk to your VA primary care and call it a day. That's it.
Okay.
There are other conditions and cancers covered under PACT Act. It doesn't seem like you have any of those because I feel like you would have told me you're diagnosed with a cancer or something like that. So I'm just going to skip. If that's not the case, let me know. But other than that, that's pretty much it. Okay. We have our migraine increase. I think this is a strong claim. I'll make it green. We have our mental health increase. I think that's a very, very strong claim. You have the evidence. I think you just need help articulating what the heck is happening. I would absolutely watch that. There's 3 main symptoms of 70%. What we're about to talk about is one of them. Irritability is another one. And then a consistent panic attacks weekly is the other one. And you have all of those. Okay. I'm very confident in you being at 50%. Depending on how much you want to pull the thread on those 3 symptoms I discussed, that would be your way to 100 or to 70%. Okay. Just on that alone. If I was to prioritize any of them, from me to you, that's my number 1. That you have current evidence. The way you reacted to that is that's most important. Okay. Bruxism. These 2 are good claims because you have evidence from service, but they're probably going to come back at 0%. Okay. And I'm just going to put this little thing in parentheses here just in case those do come back at 0%. I don't want you to freak out because I'm kind of counting on it. And this one, I would also prepare HLR if continued at 30%. Okay. Okay, there's that. Bilateral dry eyes. I'm just going to make that red. Red doesn't mean bad. It just means I'm not confident. Okay, still submit the claim. And then same thing with the hips. I'm not too confident in that because there's based on the x-rays that you showed, I think your hips would have been a part of that. Okay.
Okay.
Now we didn't really dig into your hips that much, but you have evidence from service. But your current x-rays didn't say anything about that. So I'm just going to kind of make that middle ground. Okay. But again, if that comes back at 0%, don't freak out because that's also largely rated at 0%. But other than that, those are my recommendations for you. What I want to do is play with your numbers just to show you what's going on in my mind. Okay. So we already talked about 30% mental health going to 70 is 100 alone. That doesn't include anything we talked about. Okay. Let's take your 30% for migraines and we will change that to 50. That I'm pretty confident in. So that also puts you at 91. Then if your 30% for mental health is at 50, that puts you at 94. Which is good, but it also sucks, right? Because you're so close, but so far away. Yeah. So 2 increases still put you at 94, assuming those are both increased and at 50. But you still have bruxism and shin splints. Okay, any of those rated at 10 is your way to 100. Okay, any of them. Your shin splints, you do have in-service evidence of that. So what I want to do is show you how the bilateral factor will improve for that. So your bilateral factor goes to 5.8, which already gives you a 90% out the gate, as you are right now. So the bilateral factor for your shin splints would be awesome, because if anything is increased to 50, that's 93, and then you take your migraines at 30, increases to 50. So that's another way to 100. Okay. So that's a long way of me saying there's multiple avenues for you to be rated at 100%. The most probable is by far mental health on its own. Okay. I would really look at the evidence and the symptoms for that one, like for real. And when mental health changes come down the pipe, let's talk worst case scenario now. Let's say all these come back and your mental health is at 50, but everything else stays the same and you're just kind of at like a 91%. No big deal. When mental health changes come down, you would rate an increase based on what we talked about on the new rating schedule. I still think you rate an increase on the current rating schedule now. There's no date for that. So keep that in mind. Even if worst case scenario happens, I would just wait for the new rating criteria to drop and then drop a intent to file and an increase once that does. Okay. So do you have any questions on what we talked about?
Yeah. So what is the benefit of getting something rated at 0%? Just like so you can be seen? Like if I got bruxism at 0%, would I be able to get dental care?
Yeah. So let's say you don't get 100%, but you have bruxism rated, that would offer you dental care. Once you're at 100%, there really is no benefit for ratings at 0%, unless they would cause your death, right? That's a little extreme. But a good example of that would be if you have hypertension rated at 0% because you take medication and you die of a heart attack, on your death certificate, if a link to that was hypertension, that would give you your survivor's death benefits, right? Which is important. Now, looking at your specifically, that's not really falls in that. That definitely doesn't fall in that. Your hips don't fall in that, okay? But if you're going to make any claims at all because we're submitting it, now's the time to do it. So even if I do think they'll be rated at 0%, I would still file for all of these and just get it out of the way now so you don't have to worry about it, right? And in the end, if it comes back at 10%, that's a win. Right. Especially if your hips come back at 10%, because that's another bilateral factor that we didn't even talk about.
So I'm always hearing like file within the year that you get out of service. So since this is well past the year, like, does that really matter? Or
it matters for sure. It would be wrong if I said it didn't. But for you, so your bruxism and shin splints, you have evidence in service. Okay. Same thing with your hips. You have evidence in service. Now, had you not had evidence in service, to be honest with you, I would not recommend any of those at all. The bruxism, the shin splints, and hip, I wouldn't even touch them if you didn't have evidence in service. But you do, which is rare, by the way. So good on you for that. Your bilateral eye condition with the HLR, I think it's worth a shot. I'm not really hopeful on that one at all. But if you're going to submit any claims, might as well just do it now.
Okay, that makes sense. I did have another question. Hold on. So when submitting the increase, well, actually, I guess you put the video in there. Like how I don't know how to do that, or do I just use my DAV rep? They've been all right. I'm not.
Yeah. So that's the next thing we're going to talk about, and we'll do it now. So you're represented by the DAV, which is awesome. I'm a big fan of accredited VSOs. What I would do is gather your evidence. Okay. So if you have on your blue button report, because you go see VA healthcare, in your mental health evaluations, if you have anything related to 70% symptoms, I would, even though it's in your VA records, I would print that out and submit that with your claim, because that's hard evidence if you have it, right? So if you have a note in there that says, patient struggles with connecting emotionally with her kids, that would be a solid piece of evidence. I doubt that's in there because you didn't bring it up, so you probably don't even you probably don't even know that you struggle to do that until it's like brought to your attention.
Yeah. Well, it's funny
But what-
because I met with them like a week ago, and she had said something, and I instantly was like, is it okay if we don't talk about it? But it was something about like kids, because anytime I talk about my kid and coming back, it's just like, oh. And she was like, okay, but she started to take note, and that was going to be something that we actually try to talk about in 2 weeks, because I have another.
Okay, so that's perfect. Whatever she wrote down or whatever she's going to write down in 2 weeks, if it has evidence of that specific thing, I would upload that with the claim. Okay. And when I say upload that, I mean give it to your DAV rep, especially if you feel like they've done a good job. Okay. Outside of that, though, outside of gathering your evidence, basically you take these recommendations and you say, hey, DAV rep, I want to do an increase on migraines. Here's my statement. Okay. I want to do mental health increase. Here's my statements, and here's my evidence from my primary care at the VA. I want this uploaded with my claim. I want to submit bruxism. I was seen for it in service. I want to submit shin splints. I was seen for it in service. I want to do a high-level review with an informal conference on my eye condition. And then I want to submit my bilateral hip pain that I was also seen for in service. I'm just going to put this here just so it makes clear sense. Okay. But that's exactly what you do. You just say, hey, here's what I want to do. Here's my statements. Here's my evidence. Can you help me submit this? And they will. Okay. Now, I always like giving options. You can do that by yourself, and there's some tutorials that I have on submitting it yourself. I don't recommend that, but if you want to go that route, you can also go that route too. But you like your DAV rep, so I would just use that personally. Okay. Other than that, that concludes the meeting, unless you have any last saved questions.
No, I don't. Actually, this has been great. I appreciate you taking the time. It's also nice to know that we're kind of on the same page, because I did write down where I wanted to do an increase, and it was those top two for sure. So yeah, that's it.
All right. Well, I hope I helped you. I think Absolutely. I did.
You totally
I definitely want, you don't have to, but I want, if you do reach 100%, it would be cool if you let me know, because it makes me feel good about myself.
Yeah, cool.
And then, yeah, that's about it. Thank you very much for your support. I definitely appreciate you sharing my stuff and reaching out, and that's about it.
Yes, thank you. And thank you for all that you do. I share you with everybody.
Awesome.